Hi, my name is Kinley Calloway. I'm a student nurse here at the University of South Alabama, and today I'll be performing my central line dressing change checkoff. So to begin, I would perform hand hygiene and enter the patient's room, verify the order and verify hospital policy. So we have an order for routine central line care per unit protocol. I would verify my patient using two identifiers. We have Jaguar J. Jones. Jaguar J. Jones, his date of birth is 8/25/1963. 8/25/1963. He has an allergy to penicillin and an allergy to penicillin. And I would position my trash can and perform hand hygiene. I would raise the bed to a working height and lower the side rail and position my patient in a comfortable position with the head slightly elevated. I would first just assess the dressing. I don't have the Tegaderm with me today, but normally we would be assessing for under the skin and palpate for any swelling, redness, pain. And now I will don my clean gloves. My mask and my goggles, and I will remove the old dressing. And I would just assess the site. This would be the time whenever I would assess if we needed to obtain a wound culture, or I'm sorry, if a culture was needed to be obtained. Not touching it, just looking. And I will now remove my gloves and perform hand hygiene. For the remaining of the video, I'm going to keep my mask down just so you can hear me better. I will now open my kit. And I chose to do the option in which I had all of my supplies already packaged within my sterile field. And I will now don my sterile gloves. I like to note the kit already came with a mask inside of it, so that is whenever I would put the patient mask on, but normally it would already have been done prior to this step. So I will say that this is going to be my patient's mask. I'm just going to set it right here just so that it is in the video. I can now organize my supplies on my sterile field. First, I would begin by cleansing around the site with alcohol and making sure to go over just once, not overlapping. And I would dispose of that. I'm going to keep that removed from my kit. And then I will go in with my chlorhexidine and break sterility with my left hand, just to lift up the catheter, and begin by thoroughly cleansing for at least 30 seconds around my site, going in vertical, horizontal, circular motions. Just cleaning all over everything. And then now I will place the BioPatch. I will maintain sterility by not contaminating and touching my sterile hand to my non-sterile hand, because I forgot to open my packaging beforehand. And having the blue side up. And now I can place my transparent dressing. Ensuring that it is over the hub. There are no, oh my gosh. I'm going to note that as my identified break in sterility, in which I just put my hand on the wrong side of the Tegaderm. And at this time, I would write my initials, the date and time, and place it on the outside of the dressing. And I will gather all of my supplies and dispose of them properly. And I can take the patient's mask now. And I can remove my gloves. My goggles and mask, and I would position the patient comfortably, lowering the bed, raising the side rail, placing the call light within reach, and I would perform hand hygiene. And at this time, I would document the date and time of insert or of the dressing change, document how the patient tolerated it, any characteristics of secretions, the amount, color, consistency, type noted, and I believe that concludes my dressing change checkoff. Thank you.